Yeah, hello, and good afternoon, good evening, everyone. Sorry for the delay. I was just in the class and just now got over from the class. If you all can hear me, can you just send some maybe hello or yes sir, no sir, something you can send. If I'm audible and if this video is also visible to all of you. Okay. Hello, Mukul. Very nice. Thank you for joining in, Sneha. We got late today, but anyways, let us try to take this on. Yeah, hello, good afternoon, everyone. Good afternoon. So today will be a PSM booster session. I am so much packed up with my classes today. We had to adjust time in the classes to do this session for you. But anyways, yeah, it's always a big pleasure to talk to you all. And yeah, sir, FMG students can also watch this. Ahmar Khan, yes, beta. Of course, FMG students, anyone can watch this. Anyone can watch this. Shivam Yadav, beta, for FMG students and for all students who are aspiring for your NEET entrance, I have already conducted a full community medicine review sessions. It's already available on your YouTube channel, on this YouTube channel. So you don't have to worry about these connections or like what all points we need to memorize. My main focus of the session today will be to discuss the update and few important points over here. Okay, so yeah, it will not be very long session, but I have a couple of slides. It would take around 2 hours to have a review of almost all the topics which are there in community medicine, and of course we might have another session of this sort. This is the part 1 session and community medicine booster session. Please note on Telegram channel we already have these sessions which are available for quizzes. So the quiz is already going on. Just a moment, guys. Yeah, so this is for FMG as well. On Telegram, we already have the quizzes, so I encourage you all to at least join in the quizzes. And by these MCQs and there is audio discussion, we have a different set of approach, and it is already there with you all. Sir, FMG students can also join. Yeah, yes, they can also join. It's very cold inside. They have increased the fan. So just trying to decrease the fan speed. It's too much noise on my head. Sir, Telegram group name please. My name beta, my name Mukhmohit. So that is the name on the Telegram. You can see on the top in the logo. So yeah, Telegram group is by name MUKHMOHIT. So if you just search by this name, you'll get it on this thing, Telegram, right? So yeah, let us take on the topic. Next session will be Bhaiya Mere Abhinandan Maiti. At least try to do the topic today. So today ka topic let's discuss, and very quickly let's just try to wrap up some things. And today I would like not to take much of your time. 2 hours maximum we are going to take. And which of the following is not a feature of the cohort studies? MCQ. Which of the following is not a feature of cohort studies? Not a feature of cohort studies. Very quickly, please write in the chat box which of the following is not a feature. Shows natural course of disease, finds incidence, finds risk ratio from effect to cause. What do you want to say? Which of the following is not a feature of cohort studies? So natural course of disease, yes, definitely. Finds incidence, yes, definitely. It is about finding the risk ratios, yes. It is from effect to cause. This is wrong answer. This is for case control studies. Just for all the students who have revised, this is a revision session. I'm not here to explain things to you, but just for you to know, you should take a screenshot of this topic, of this section. We have these very famous 4 study designs: cross-sectional, ecological, case control, and cohort studies. So please note that the ecological studies are correlational studies. Case control studies are the only one which are retrospective. No study will give you prevalence except the cross-section study. Right? Please note that no study will give you incidence except the incidence is given only in one study, which is the cohort studies. Cohort studies are cause to effect and not effect to cause. So absolutely correct. This is a very quick review, and a very quick review about the formulas. What is the formula for risk ratio? Risk ratio is given by the formula incidence exposed over incidence non-exposed. What is the formula for odds ratio? It is A into D over B into C. That is the logical cells divided by the non-logical cells. What is the formula for attributable risk? Attributable risk is given by the formula incidence exposed minus non-exposed over incidence exposed. Population attributable risk is incidence total minus incidence non-exposed over incidence total. That is population attributable risk. You should also know that attributable risk is the amount of disease which are there in the total population among the exposed. So the amount of disease which happens because of the risk factor, amount of disease which is because of risk factor among exposed population. So among the smoker group, how many people get heart attacks because of their smoking? This concept is what we call as attributable risk. So please make sure you get it right in your head that it is among the exposed. What is population attributable risk? It is among the total population. So it is the percentage of decline in disease with a change in risk factor, among total population. It is among total population. Please take note, put it directly into your head that attributable risk is among the exposed, population attributable risk is among the total population. Next MCQ, maybe this is pretty small for you guys, so let me just try to increase the font size if I can actually be able to do it. Let us put some bigger number. Oops, it went too big. So that's the whole problem in these things. Anyways, let's take on. I think this should be readily readable by you guys. So what do you want to say? It's still cold in out here, buddy. A research is being conducted to find the association between aniline dye industries and bladder cancer in the workers of an industry who have worked for more than 20 years. 2 groups were found, one directly involved with dye handling, other group with office clerks not exposed. Years of occupation were noted. So which of the following is correct? Many students answering A, some are answering C, some are answering A. Well, so in the question says that in workers of industry who have worked for more than 20 years. So the study was conducted in industrial workers who have worked for more than 20 years. So 2 groups were formed, one directly involved with dye handling and another group was office clerks. So years of occupation was noted from previous records. So it is a record based study. It is not a case control study. We did not take cases and controls. This is a typical example of a retrospective cohort. You are going to mark retrospective cohort. Mukul Singh, beta, it is not. Pooja, it is not. C option. Itish, Dayama, it is not C option. It is option A, that is retrospective study design. Case control study, kab hota? When would it have been a case control study? It would have been, you would have marked a case control study in case, you would have marked a case control study in case this question would have said that we had taken bladder cancer patients and non-bladder. In that case, we would have gone with retrospective study design. So in case of Abhinandan, it would have been case control study. If we would have taken people with bladder cancer and normal patients, and then we would have asked them yes risk factor or no risk factor. But in this, we made two groups now, considering of office clerks and another with the die handlers. So we started with risk factor yes or no, but you go back in time. This is a retrospective cohort, classical example of retrospective cohort. Next MCQ, again I need to probably increase the font size of this, so this should be enough for you guys. Selection bias case control study, select the incorrect match. Selection bias is found in a case control study, Hawthorne bias for cohort studies, Bergsonian bias for hospital-based, publication bias in cross-section studies. So which of the following do you think is the incorrect? Selection bias can happen in case control studies. You have to select cases and controls. Now, because you're selecting cases and controls, there is a chance in a case control study, beta, there is a chance that there is a selection bias. There is a chance that there is a selection bias. Yeah, so there is a chance that there is selection bias. Whereas in a Hawthorne study, what is Hawthorne? Hawthorne is change in attitudes while under observation. It is typically found in cohort studies. It is also there. It is also there in cohort studies, and also there is in trials. Bergsonian bias is a hospital-based case control study. That is also correct. And publication bias is where the publication does not happen properly, where the publication is a problem in the journals. It is usually you would see that in evidence-based medicine. Evidence-based medicine, you would find out when you're talking about publication bias is entirely different. It's not related to a cross-section study. So in evidence-based medicine, we might face a publication bias. Publication bias is not found in evidence-based medicine. So yes, it is related to evidence-based medicine, where you watch a journal, and in the journal there might be some journals which are publishing specific type of studies. So in publication bias, please note that we can observe a funnel plot. What we can make is funnel plot whenever we are going to check for the publication bias. In a funnel plot, it will be like a funnel, and the center point is here, and this is the baseline. So a funnel plot says that whenever the studies have to be published in the journals, then the journal should ideally be publishing any type of study. So it could be the negative effect studies, or it could be the positive effect. They should almost always be symmetrical. But if they are asymmetrical, for example, there are no studies which are published over here in this area, so that means this funnel becomes asymmetrical now. So you have the funnel plot on one side, whereas on this side there is asymmetry in the funnel. So this is what we call as publication bias. Future doctor, sir, for FMG. Yes, sir, this is for FMG as well. So pad lo, sab log padho. This is incorrect match is publication bias. Next, coming to the next MCQ. All the questions, I think we have to increase the font size for them. So coming over to the next one, the death rates in two population with different age group needs to be compared. The reference population is available, but the age specific death rates are not available. The best method to compare the death rates will be, so now there are death rates in two population with different age groups, and with different age structure. So the reference population is available, but The age-specific death rates are not available. Age-specific death rates are not available. So what are you going to do? Will you do linear logistic regressions? Will you do indirect direct standardization? Please note, absolutely correct, beta. The correct answer over here in this question, it is option B. That is, it is option B. That is, we are going to get option B, indirect standardization. So what do you mean by indirect standardization? When will you just do MCQs? When will you do standardization? Standardization is done when the reference population is available. So reference population is always required. Okay, in standardization you are going to compare two populations with different age distribution. When will you do direct standardization? Direct standardization we are going to do. So when are you going to do standardization? Standardization is done to compare death rates in different populations with different age structure, So if different age structure populations are there, you are trying to compare them. This is what we do standardization. Now, any day for standardization, you need a reference population. So once you need a reference population to compare the death rates. So reference population is available. So now you take is, if in the age specific death rates is available for your checking population, you will do direct standardization. And please note, if no age specific death rate is available, then we do indirect standardization. In indirect standardization, what are we going to calculate? In indirect standardization, we are going to calculate the observed deaths divided by the expected deaths. The observed deaths divided by expected deaths into 100. This is the standardized mortality ratio. If the observed deaths by expected death is 1, like observed is equal to the expected. Take it for understanding. If the observed deaths, the number of deaths you are observing is equal to the number of deaths you were expecting, that will be, the observed will be equal to expected, na? If the observed by expected is same, that means the ratio will be 1. Now 1 into 100, 1 over 100 into 100 will be 100. So if the beta, that's what I want you to write down, standardized mortality ratio, if it is 100, that means there is no difference in the death rates. But if the standardized mortality ratio is more than 100, what does it mean? If the SMR, standardized mortality ratio, is more than 100, what does it mean? That means the deaths are more in that population than the expected. Did you get that? I'll repeat it again. If the, now beta, try understanding, the MCQ has asked so many times about the standardized mortality ratio. Now if the standardized mortality ratio is more than 100, what does it mean? Now MCQ may be about the interpretation of these. If the standardized mortality ratio is more than 100, what does it mean? If the standardized mortality ratio is more than 100, that means that the deaths are happening in more number in that particular area. Deaths are more in number in that particular area, right? So please note, if the SMR is more than 100, it is very important for you to memorize this, to know this. What is regression? What do you mean by regression? Regression is a statistical term. Regression, it is a statistical term which means to regress. Regress means to predict whether the outcome will be this or that. So predicting an equation based on the variables which are present is what we call as regression. So regression, please note, can be of two types. We can have a linear regression or we can have a logistic regression. The linear regression is done for quantitative data or for parametric numbers, whereas logistic regression is done for qualitative data or for the non-parametric numbers. The linear regression is done for parametric numbers or for quantitative data, whereas the logistic regression is done for qualitative data or for non-parametric numbers. So that is about the linear regression and logistic regression. Next is coming again, I have to make this whole thing bigger, and let's make it bigger. A large cohort study was done to establish a reference range for diagnosing GDM at 95% confidence interval. So the 2-hour median 2-hour blood sugar was obtained was 120 plus minus 10. So that's what is the 2-hour blood sugar, 120 plus minus 10. Okay, how much population may have the fasting blood sugar more than the upper range? So it's a very simple MCQ. If you can just answer it, what do you want to say? What is the best answer over here? What do you want to say? What do you want to say? Naveen says C, Karan D, Mukul 5. Okay, it is a very simple MCQ. So now you already know that a GDM 95% confidence they were making. So now the 2-hour blood sugar is 120 plus minus 10 beta. 2-hour is 120 plus minus 10. You already know this is the normal distribution. In this normal distribution, you have as the standard deviation equal to 0, SD equal to 0. And then you have at the center point, right? That is the center point, SD equal to 0. Then you have plus 1 SD, plus 2 SD, plus 3 SD, and minus 1, minus 2, and minus 3. If you look at the screen, like between plus 1 and minus 1, how much percent of the population is going to lie? Between plus 1 and minus 1, 68% of the population will lie. Between minus 2 and plus 2, how much percent of the population? 95% of the population. And between minus 3 and plus 3, how much percent of the population will lie? 99% of the population. So very simple for you to understand. What should I write here in this? So if the data given was 120 plus minus 10 milligram deciliter, so 120 plus minus 10 milligram per deciliter. So what should I write in the center? It should, in the center I will write it as 120, and then plus 1 standard deviation on the right hand side. Plus 1 standard deviation is 10, so it will be 130, then is 140, and then is 150. On the back hand side, similarly on the back hand side, it will come out to be 110, 100 and 90. Am I correct? So this is what you need to draw, and what you need to know, that at the center point it is 120. So now it is very simple. You already know, if you already know that between 100 and 140, you already know between 100 and 140, you already know 95% of the population are going to lie. So the upper reference curve is like 2 standard deviation. How many will be more than this? How many will be more than this? The total under this normal distribution you already know is 100. So 100 minus 95. 100 minus 95, that is 5%. Now out of 5%, half will be this side, half will be the other side. Now, thank you. Lada coffee. So 5% is the total amount. Out of this 5%, half will be here and half will be here. Did you get this? So what is the best answer in this? So how much population will have fasting than the upper reference range? What do you think? Upper reference range answer is 2.5%. Answer cannot be 5%, because beta, how many at where you think will have, question for you guys, where will you think people will be more than 5%, or 5% people will have more than how much blood sugar? What do you want to say? 5% population will have blood sugar greater than, or will have blood sugar between, let us say, what do you want to say, 120 to 125, 125 to 130, 130 to 135, or you think it is 135 to 140? What do you want to mark? as the best answer? What do you want to mark as the best answer? There's a question for you guys. Can you think and tell me? Can you think and tell me? 5% will have blood sugar more than how much? What do you want to say? Yeah, I think many of you have already got it now. Now, do you understand that more than this is how much? More than this 140 range. More than 140 is how much? 2.5%. है ना? More than 130 is how much? More than 130 is how much? Like how many people will be 16%? So if this is 2.5, if this is 2.5 beta and this one is 16, 5 will be where? 5 will be somewhere around this point only, na? Somewhere around this point. At this junction, it will be somewhere around 5%. So that means it will be around 135 to 140. That is correct answer. 135 to 140. That is the correct answer. Good. So if you have this understanding, very, very nice. Very, very nice. Urban health facility, thank God I didn't have to increase the font of this. Urban health facility targets the population of 10,000 with a crude birth rate of 20 per thousand. Calculate the amount of FIPV vaccine vials required per month. Use a wastage factor of 1.1. I know many students must be getting scared that, sir, what are you doing? These questions have not been taught to us. But thank me later in case you get this question. Thank me later in case you get this question. This is important. Like not from exam, only exam, but it is important from the government perspective as well. So you are in an urban health facility, targets a population of 10,000 with a crude birth rate of 20 per thousand. Crude birth rate is 20 per thousand. Calculate the FIPV vials required per month. Any idea? You need pen and paper, but very soon you will be able to do this mentally. I'm waiting for your answers. If you can answer this, I'm waiting for your answers. I know this is slightly on a difficult side, but at least anyone who has the courage to answer it, say anything. How many vaccine vials? Everything is written in front of you. Any idea? Okay. So I'll help you out in this. B, at least someone tried to answer it. Karan Shah, hats off. I like your attitude. I like your attitude. But many students are answering 10 over here. Okay. Abhinandan says 36. Very nice. At least you answer something. I know none of you is going to give the correct answer, but maybe some of you might be giving correct answer. Some of you might be giving correct answer. Hai na? So good. A bhi aa gaya. D, Y, floss says A. Everybody says B and C. Why not D, beta? Anybody for D? 660 nahi karte. You don't like this huge number? Anyways, very simple. Take it easy. Take a deep breath. Listen to it. Listen to Babaji. Very easy. Take a deep breath. Now, urban health facility targets a population of 10,000 with a crude birth rate of, I'll tell you how to solve this MCQ in case you get it. Very easy. So now the crude birth rate is saying is 20 per thousand. Okay, crude birth rate, think it, everything. You don't need actually pen and paper. Crude birth rate is 20 per thousand. If the crude birth rate is 20 per thousand, total population is 10,000. What is the total births which are happening in that area in 1 year? So in 1,000, 20 birth happen. In 10,000, how many birth will happen? In 10,000, total 100 births will happen. 200 births will happen. So 20 in 1,000 in 10,000, total 200 births are going to happen. 2,200 births will happen per year. Okay. So now these many births are there in 1 year. Okay. So for every birth, how many FIPV doses you need? How many FIPV doses we need? How many FIPV doses? Beta, the total vaccine requirement is given by the formula total number of doses for that vaccine multiplied by the total live births into the wastage multiplicative factor. So total how many doses? Pranav says 3. Very nice. You already know that FIPV under the new program, FIPV, very nice, is given 3 doses. The first and the second dose, do you know it is 0.1 ml intradermal? Where do we give it? It is given in the right upper arm. It is given in the right upper arm. Whereas the FIPV third dose, it is given, when do you give first and second? When do you give first and second? It is given at 6 weeks and it is given at 14 weeks. And the third dose is given at 9 months of age. 9 months of age. And do you know it is 0.1 ml intradermal in the left upper arm. It is given in the left upper arm. Okay, very nice. So total beta, how many doses of FIPV we will give? Total, I would like to give 3 doses of FIPV. How many live births are there? 200 live births are there in 1 year. Into wastage multiplicative factor, that is 1.1. So total will be 3 times 200. Just mentally you do it. 3 times 200, 600. 6 into 1.1, 6 into 1 is 600, and 0.1 will be adding 60 extra. So 660 FIPV doses are required in 1 year. So total in 1 year, beta. Now total in 1 year, how many FIPV doses are required? 660. So in 1 year, if you require 660, in 1 month, how many you will require? In 1 month, how many you will require? 600 divided by 12. 12 months are there. 600 by 12 is like 12 fives are 60. So I will remember it as 50. Plus 660 is there, 660 plus another 5. So answer is 55. Divide per month, if you want to calculate, it will be 55 per month, na beta? 55 per month aa gaya. So in 1 month, you need 55 doses. Now, how many vials, vaccine vial is there? In 1 vial, there is 20 doses. In month, you require how many doses? In month, you require 55 doses, na? And in each vial, how many doses are there? 20 doses. So, le de ke how many vials you will require every month? Total, I would be needing 3 vials every month. Did you get this? It's a beautiful MCQ. You can do it on your own. You can do it on your own. Watch this video later. Thank me later. It is a very easy MCQ, and bet me 95% of the population is going to leave this question and go. They will leave this question and go, and in case you get it in your exam, you will rock the exam. Okay, so I just pray to God you get this type of question which you already know. So let's go to the next one. Consider the following and mark the incorrect one. This is very easy. How did you calculate per month, beta, Prachi? Very easy. So in 1 year, beta, 660 na? So 660 divided by 12 will be per month aa jayega na beta? Right? 660 divided by 12. That is 55. Okay? Consider the following. Consider the following and mark the incorrect. IMR is 28 per lakh, MMR is 97 per lakh, crude birth rate is 19.5 per lakh, and lifetime maternal risk is 0.21. Mukul Singh, just watch this video later. You will understand. 55. Then how 3? 3 is like 1 vial has 20 doses. 55 3 vials will have 60 doses. So consider the following and mark the incorrect. Obviously, I think most of you, everybody is answering correctly. IMR is 28 per 1000. IMR is 28 per 1000 live births. It's not per lakh. Okay, it is per 1000 live births. It is per 1000 live births. MMR is 97 per lakh. CBR is 19.5. Lifetime is maternal risk is 0.21. So this is you can take a screenshot of this. This is pretty important. What is the birth rate, death rate? Every data in the country is given to you. Every data in the country is given to you, and specifically remember about TFR. What is TFR, total fertility rate? It is total number of children a female will bear during her reproductive years, assuming the age specific fertility rates. That is total fertility rate. Sex ratio at birth is 929, but the total sex ratio in India is 1020. TB incidence is not 312, just remember it has been updated 188 per lakh. Leprosy prevalence, we are proud to say, is 0.5, ANCDR is 5.5. Leprosy prevalence is 0.45, ANCDR is 5.5, grade 2 disabilities is 2 per million, and HIV prevalence in the country is 0.2. So this has been asked a couple of times. Infant is 28, neonatal 20, maternal is 97, maternal mortality rate is 6 per lakh, whereas lifetime maternal risk is 0.21. So TFR is 2.0 beta, target dopamine is 2.1. The TFR currently we have is 2.0. The current TFR that we have is 2.0. Okay. Coming to the next MCQ, find the incorrect match option. Suman scheme, service guarantee, no tolerance to denial. Jai Vigyan, promote girl literacy. Muskan, quality of child friendly services. PM Matru Vandana Yojana, incentive for mother and child. So what do you want to say? Find the incorrect answer. Jai Vigyan, absolutely correct. Jai Vigyan is not for promoting girl child literacy, it is for promoting the knowledge about rheumatic fever. Jai Vigyan is for rheumatic fever. Absolutely correct, beta. Jai Vigyan is for rheumatic fever. In Jai Vigyan, you have to memorize. There are 4 points for us to know. The Jai Vigyan mission is to understand about streptococcal infection. Streptococcal infection prevalence in the country. It is also to find out the prevalence of rheumatic fever prevalence in the country. Streptococcal infection prevalence in the country. Then third point is that it works on to understand in depth, deeper understanding for pathology of rheumatic fever, and last is to promote vaccine development, for rheumatic fever, So Suman scheme is service guarantee scheme, that is correct. Please note that the Suman scheme is a service charter guarantee charter scheme. All the schemes are under this umbrella program of Suman scheme. Next is, what is Muskan? Muskan talks about child-friendly quality services, Muskan talks about child-friendly services in the hospital. So it is to promote child-friendly services in the public health facility to reduce the newborn and child morbidity and mortality, right? So that's it. I think Matru Vandana Yojana. What is Matru Vandana Yojana for? Matru Vandana Yojana has been updated. This is the update session. So please note that the Matru Vandana Yojana is first installment. Yes, Mukul Singh Pradhan ji, aapke liye aa gaya. It is there in front of you. Can you tell me, yes, 2 times how much more? So please note, first installment is given at 3,000 rupees and the second installment is 2,000. First installment kab jayega? When is it given? When at least one ANC has been done within the 6 months of the last menstrual period and the registration of pregnancy is complete. The second installment is when the child is registered and the child has received the first dose vaccine, BCG, DPT, OPV, hepatitis B. Okay, so this is the first and the second dose installment. There is a new program that in case, so total how much we are giving? 5,000 rupees. Please note, this is for the first born child only. Now there is a new strategy, there is a new system that in case the second child is a girl child, the mother will get extra 6,000 rupees. So extra 6,000 rupees to the mother, that is in case the child is second child. In case the second child is a girl child, the female is going to get again 6,000 rupees, right? So Yeah, this is the name of the channel. Somebody was asking this. This is the name of the channel. You can join in for the Telegram or the, I don't know, I can't even see this. This is just my name, Mukhmohit, and that's the Telegram channel. So, what is the best answer over here? Jai Vigyan Mission. If it's a boy, Jain kuch nahi milta. Boy bekar. Nothing. Nothing. Any difference between institutional or C-section? No. Next is home-based young child scheme requires ASHA workers for home visit after for every how much time? They will require ASHA worker for how much time? In a home-based young child scheme require ASHA worker 3 monthly? Yes, correct. It is 3 monthly visits. Absolutely correct. It is 3 monthly visits. Home-based young child. Please note in the home-based young child HBYC program. HBYC, the ASHA worker is going to have 5 visits and 3 monthly visits. There are 5 visits which are 3 monthly visits. In HBNC beta, home-based newborn care, home-based newborn care in HBNC. In HBNC, the female is going to visit every week, 7 day, 14 day, 21 day, and all these days, 7, 14, 21, 21, 28, all these days. And in this, something happened to the iPad. Just a moment, please. Something happened to the iPad, right? It just went off. So it's also tired now. We were at this point, right? Yash, sorry to disturb. Will you be taking FMG session? Beta, FMG session I have just very recently taken, and this FMG session is available on this YouTube channel only. It was taken in January. It was done in 2 parts. Total 5-hour duration. That is absolutely good for your FMG this year exam. There are no updates beyond this. So Yash, for FMG, that is the session you should see. In this session, we are just revising very quickly and using the MCQs. Home-based newborn care, beta, just remember in home-based newborn care, we are taking total how many visits? There are 6 visits. In newborn care, we are doing 6 visits, and these 6 visits are for normal delivery. In case of cesarean section, it is total 1 visit is less, 5 visits, and in case of home delivery, it is 7 visits. Home delivery, it is 7 visits. Okay, home delivery is 7 visits, and that is home-based newborn care. So that is the best answer, 3 monthly visits. Coming to the next MCQ, average calorie requirement for a female in her 2nd month of pregnancy. Average calorie requirement for a female in her 2nd month of pregnancy. 2nd month of pregnancy, what are we going to give extra? 350 calories to 375 calories, 230, 280, 70 to 90, or 390 to 470. So mostly students are saying option C, which is obviously the incorrect answer. If it was option C, I would not have asked, because the whole country knows it is 350 calories extra. The female needs 350 calories, but this is the average. The female needs extra in total pregnancy. In total pregnancy, the female will need extra of 350 calories. Right? So please note, there is a calorie distribution that in the first trimester how much the female needs to take, in the second and in the third trimester. In the first trimester it is 70 to 85, second trimester is 230 to 280, and third trimester is 390 to 470. So please make note of this. First trimester roughly you can remember it as 80, second trimester 250, and third trimester you can remember it as 420. So just remember, this is the average calorie requirement, which will come out to be average as 350 calorie you will get. So what is the best answer for a female who is coming in the second month of pregnancy? Right, second month of pregnancy. So Ishaki Riaz, thank you for one touch and boosters. Thank you so much. Exam clear हो गया, क्या बात है. I am so proud of you and thank you God कि आप लोग क्लियर हो रहे हो एग्ज़ाम को, एंड यही हमारी दिल से तमन्ना है दैट यू शुड क्लियर योर एग्ज़ाम. सर, इन योर क्वेश्चन इट इज़ आई कांट सी एक्चुअली, it is first month. In my question it is first month. Where it's in her second month of pregnancy. My question first month कैसे लिखा है? So in my question it is second month ना, तो obviously that is in the first trimester. What is the best answer? The first trimester will be 70 to 90 kilocalories extra. Very simple. 70 to 90 kilocalories extra will be given for the first trimester. Okay, so ये एक और table है. Just take a screenshot of this. This is very important table and frequently asked to you in your exam. Only update is this is not 40, this is 27. So in a pregnancy, 29 in normal female, 27 milligrams per day in pregnancy, 23 in milligram in lactation. Please note, it is not 40. It is lesser iron in pregnancy compared to a normal female. Okay. Then iodine is slightly more, 150, 250, 280. So this is one table. Every year they ask you question from this table, and this you have to study for your exam. There is no way you can forget this. I will highlight whatever already has been asked. Body weight has been asked, protein has been asked, iron has been asked, iodine has been asked, vitamin A and calcium has been asked. Folate is common sense. I think you already know that folate will increase by triple, right? ओके, वन टेज के जितने भी टेबल हैं सब पी जाओ, हो रहे हैं आराम से 8 क्वेश्चन हो जाते हैं. या एब्सोल्युटली. So Abhinandan, I have shown you what all components you need to remember in this table, and that's what is required for your exam. I'm just trying to set up my screen because I can't see your comments now. So I'm just trying to set up the screen. Okay. Let us go to the next MCQ. In the ICDS growth chart, malnutrition is defined as, what do you want to say? In the ICDS growth chart, malnourishment is defined as below 95th percentile, below 3rd percentile, -2, -3. Malnourishment. किससे नीचे को कहोगे? When do you say malnourishment? Kaustab More, sir, is there any PDF that contains all essential things we need for NEET PG at one place? That PDF is available in form of a book called as One Touch PSM by CBS Publishers, and you are advised if you can take that. That is most important. So in ICDS, malnutrition is defined as, absolutely correct. This is the growth charts, beta. This is the growth chart. In the growth chart, you will see these curves over there. The upper curve, middle curve, lower curve. The upper curve is at +2 standard deviation, -2 and -3. Any child who is between -2 and +2, this child is called as the normal growth. Below -2, this child is called as the mild to moderate malnutrition. And then below this -3, this child is called as severe malnutrition. MCQ on malnutrition, you should also remember plus 2 also corresponds to 97.5%. So it is already 97.5%. You should also remember that in malnutrition, weight for age, weight for height, height for age. Which of the following is a marker for acute malnutrition? Weight for height. Height for age is for chronic, weight for age is a general marker, or it is a combined marker for malnutrition. Which is the general marker for malnutrition, which is age independent. Age independent marker for general marker for malnutrition, that is mid upper arm circumference. When do you say mid upper arm circumference? Shakir's tape. It is less than 11.5 or more than 12.5. More than 12.5 is normal, less than 11.5 is severe malnutrition. This is what we use as Shakir's tape. Shakir's tape. Now, next MCQ, what do we mean by a SAM child? SAM child is a child who is severe acute malnourished. Because it is acute, don't get confused, it is weight for height, because weight for height talks about acute malnutrition. It is severe. Severe means less than -3 standard deviation. Less than -3 standard deviation. Plus, there is also mid upper arm circumference, which is less than 11.5. As we have already done, less than 11.5 is a severe malnutrition. Is the severe malnutrition. Then there is also bilateral pedal edema. Bilateral pedal edema. In those children, SAM children, what do? We send them to NRC. What is NRC? Nutritional Rehabilitation Centers. In nutritional rehabilitation centers, we have stabilization phase, we have the transition phase, and we also have the maintenance or the rehabilitation phase. In the stabilization phase, please note we give the F75 diet, which is the starter diet. The starter diet, F75 diet, it contains 75 kilocalories and it contains 0.9 grams of protein. On the same principle, the transition diet is a F100 diet, which is also called as a catch-up diet, and the catch-up diet is a 100 kilocal and it contains 2.9 grams of protein. So remember, in the transition phase, it is triple amount of iron of protein which is given compared to the stabilization phase. In the maintenance phase, this is going to get the child is going to get a home-based diet. Next, you should also know when are you going to release the child from the NRC. What is the discharge criteria? Discharge criteria is when the child is able to complete more than 90% of the expected feed. If the child is able to complete more than 90% of the expected feed, the child is released, discharged from the NRC, and they are sent for the maintenance home-based diet. So please also note that in the stabilization phase, no iron is given because iron may lead to weight loss, fluid overload, and cardiac toxicity or cardiac overload. So that is about the malnutrition points for you to remember. In ICDS growth chart, coming to the super simple MCQ, sweet MCQ, malnutrition is defined as, that's such a sweet MCQ. Beta, everybody, every Tom, Dick and Harry in the world should know that malnutrition is less than -2 standard deviation. Okay, that was how many minutes, how many seconds? I think I discussed the whole malnutrition chapter in less than a few seconds. And did you watch that? Did you watch that? Yeah. Sir, this video, sir, don't remove from the video. Beta, this video will stay till your exam, till your June, July exams. This video is going to stay. Don't worry about removing it. Okay, compared to the cow milk, the breast milk has, what do you want to answer? Compared to the cow milk, the breast milk has. The breast milk has. What do you want to say? Most of you are answering C or B, C or B, C or B. DYFLOS, floss. That's a DY floss. What does this mean, DY floss? Are you a dentist? Flossing? Nice name. मैम रोटा वायरस वाली ओपन वायल पॉलिसी फॉलो नहीं करती क्या? हाफ इंजीनियर भाई, आपको मैं मैम दिखता हूँ? मुझे पहले ये बताओ यार, मैं नहीं क्लास ले रहा है ऐसे। मैम क्यों लिखता है मेरे को? मैं कहाँ से तुम्हें मैम दिखता हूँ यार? बाल भी नहीं है सिर पे, मैम हूँ कोई? ये क्या बात बनती है? दिस इज़ नॉट गुड। मैं तुम्हें मैम क्यों दिख रहा हूँ? डू आई लुक लाइक अ मैम? ना 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 ना, चेंज कर दे भाई। इतने लोग कमेंट डाल के डिलीट करते हैं। सो कंपेयर टू द ब्रेस्ट मिल्क, विजुअल हेलुसिनेशन, या बिफोर द एग्जाम ऐसा ही होता है ये। मतलब मानना कि जेंडर वो चल रहा है आजकल के इतना। और क्या सर, नौजवान, बिल्कुल नौजवान है भाई, दिल के नौजवान होने चाहिए। है ना? एग्ज़ाम सिर पे है और तुम ऐसे सर मैम कर रहे हो, गलत बात है। सो या, compared to the cow milk, the breast milk is lower quantity protein, adequate source of iron till 6 months, low sodium या high fat content. Which of the following is correct? What do you want to say? What do you want to say? It is, beta, the breast milk is known to have low quantity protein. The quantity of protein is lower in the breast milk. The quantity is lower in the breast milk. That means the breast milk is having 1.1 grams of protein, whereas the cow milk, it roughly has 3.1 grams. So cow is like three times more higher proteins. So one is true. Adequate source of iron, yes, because the human milk, please note, human milk has high vitamin C and it has low calcium, and that is the reason it is adequate source of iron till 6 months of age. Third option, it has lower sodium. एक कप में डाल। Third is lower sodium. What do you want to say? Yes, lower sodium is also correct. Please note, human milk is the one of the milk which is low sodium. Next is high fat content. High fat content is not there. It is not high fat content. Please note, it is lower fat content in breast milk compared to the cow milk. So 1, 2 and 3 all are correct. 1, 2 and 3 all are correct. So B is the correct answer. सर यूपीएससी एसआईसी नर्सिंग ऑफिसर के लिए CHN इम्पॉर्टेंट टॉपिक क्या क्या है? इट्स ऑलरेडी डिस्कस्ड इन योर CHN मोबाइल ऐप, बेटा, नर्सिंग नेक्स्ट लाइव. सो yeah, this session we are primarily dealing with the NEET exams, where we talk about some higher stuff regarding epidemiology, biostats and so on. So yes, option number B is correct. ये lactulose का क्या करना है बेटा? It is human milk. It has the highest lactose. Human milk has the highest lactose. Does rotavirus follow open vial policy? No, rotavirus, yes, it follows open vial policy and it is changed now. Coming to the next one, please note, breast milk, it is low fat, it is low quantity fat, but do you also know it is good quality fat? What is good in this? It has very high amount of PUFAs and it has high amount of DHA. It is known to be low protein, but do you know it is good quality protein in terms of it has very high amount of whey proteins. It also has a lot of immunoglobulins, and human milk is also known to be good source of cysteine and taurine, which are all used in brain development. Next is, what about the low sodium? Yes, it is low sodium, it is high lactose, it is low calcium with higher vitamin C. So it is not a rich source of vitamin C, high vitamin C compared to all other sources. Milk, compared to all other milk sources, human milk has slightly higher vitamin C. Next, that is the reason, because it has high vitamin C and low calcium, that is the reason it is known to be having adequate iron. Okay, good. So let us come to the next one. All of the following are contraception can be provided to a female who has 1 month old baby and is non-lactating except. What do you want to answer? All of the following are methods of contraception. What do you want to answer? What do you want to answer? Option C. All of the following methods can be provided to a female who has 1 month old baby and is non-lactating. 1 month old baby and is non-lactating. What do you want to answer? इसमें थोड़ा शुगर मिल जाएगा. क्या बोलते हो? So it is non-lactating. The female is non-lactating. What do you want to answer? Option C. Yeah, Mukul कह रहे हैं OC pill after 6 months if she's breastfeeding. Yes. So please note, this is the criteria for initiation of the postpartum family planning methods. Postpartum family planning methods. Okay, postpartum family planning methods. I'll just simplify this. If you want, you can take the screenshot of this, but otherwise I'll just simplify this. Very simple. You take down what I am writing right now. So please note, if we talk about the intrauterine device can be inserted within 10 minutes. It is called as post-placental IUCD insertion. It can be inserted from 10 to 48 hours, 10 minutes to 48 hours, which is postpartum IUCD insertion, or it can be inserted after 6 weeks. So in a post-delivery phase, irrespective of the breastfeeding, either be inserted within 48 hours or it is inserted after 6 weeks. Next MCQ regarding oral contraceptive pills. Oral contraceptive pills, you have to see if the female is breastfeeding or not. If the female is breastfeeding, the OC pill should be after 6 months. Please note, it should be after 6 months. And in case of non-breastfeeding, they can be even after 3 weeks. So please note, that was the MCQ which we were asking, that in a non-breastfeeding female, can we give OC pills? It can be started even after 3 weeks. Next is regarding Antra. If you talk about Antra, beta, Antra is DMPA, depomedroxyprogesterone acetate. Antra is given at the rate of 150 milligram intramuscular injections. It is 150 milligram intramuscular injection. Now the Antra injection, beta, Antra injection, do you know, if the female is breastfeeding, you can't give the progesterone in the female because she is breastfeeding. In the breastfeeding female, Antra is recommended only after 6 weeks. Antra is recommended only after 6 weeks. Right? Beta, no. Arjit Gupta, Sakshi ma'am told OC pills are CI contraindicated whether breastfeeding or not. No, for the first 3 weeks they will be contraindicated. After 3 weeks, beta, they can give OC pills. And of course, this has been discussed intensively by Sakshi ma'am as well, by myself also, and we both are on the same line on this. I think your knowledge needs to be updated, beta. Please watch the lecture again from Sakshi ma'am. She must have said, and obviously I know she would have said that the OC pills in the first 3 weeks are contraindicated. After 3 weeks we can give OC pills. Why? Because the female becomes more there's more chances of thromboembolic phenomena, because OC pills, they may lead to more coagulation, more thromboembolism, right? So they may be more atherosclerotic, and a pregnant female is already in the hypercoagulable state. So for first 3 weeks it is contraindicated. After 3 weeks in non-lactating you can give. In breastfeeding, this thing, right? So Antara beta, if it is breastfeeding, it is after 6 weeks. If non-breastfeeding, then Antara can be inserted, Antara can be started anytime. And do you know that Chaya tablets, they can be started anytime. Chaya tablets are started anytime. This is one topic which you will find only in my lectures. It has been discussed much in detail, and I'm very proud to say last 2-3 years all the questions have been coming from this integrated table only. Antara beta, please note it should be given on the due date, but the female has a leverage of taking it 2 weeks before to 4 weeks after the due date. So please make sure you get this all things right, sorted for your exam. All of the following can be provided to 4-week-old baby, mother of the baby who is non-breastfeeding. DMPA, can it be given? Yes, it can be given. Centroman, yes. Ocipils, can they be given? Yes. IUD, can it be given after 4 weeks? It needs to be given after 6 weeks. So this is no. So option D is the correct answer. Okay. Next is, which of the following is incorrect for the National Immunization Schedule 2023? Which of the following is incorrect? Sir, which is postpartum, which is post-placental? Post-placental bhai mere after 10 minutes, and postpartum is post-placental is within 10 minutes. After 10 minutes till 48 hours, it is postpartum. I'll repeat again. Post-placental is within 10 minutes. Post-placental is within 10 minutes. Postpartum is 10 to 48. Which of the following is incorrect? Batao fatapat se. Which is incorrect? Option D. Many students are saying measles is given at 9 months of age. What do you want to say? Measles at 9 months of age. Common sense. Everybody in the country should know it is true. PCV booster is given at the 9 months of age. Yes, it is correct. It's not actually PCV2. It is PCV booster, because PCV1 is given at 6 weeks, PCV2 is given at 14 weeks, PCV booster is given at 9 months of age. So this is also incorrect. JE is 16-24 months. Yes, this is correct. FIPV third is at 16-24 months. No, this is not correct. It is given at 9 months of age. So please note option B and option D both are incorrect. If you just want to remember the National Immunization Schedule, this is the baby that we have, and this is the kid, and it's a very famous kid now, and all of the students have this kid in their copies, and some have even pasted on the wall. So this kid, it is showing you all the vaccines which have to be given in the child. PSM ka pyara bachcha. Yes. So absolutely correct, beta. Absolutely correct. Both option B and D are false. Let us go to the next one. Which of the following statement is not correct? Which of the following statement is not correct? What's his name? His name is... that's a good question, Karan Shah. इसका नाम होना चाहिए. कोई नाम suggest करो यार इसका. तुम लोग suggest करो. That's a very good thing. कुछ नाम होना चाहिए इसका, है ना? Nice. I like this idea. There should be a name to this child. गोलू. मेरा लाल. हाँ, गोलू मेरा लाल. सही है. गोलू नहीं, कुछ तो बब्बू मान है. बब्बू मॉन. There should be. नहीं बेटा, J is not in the left upper arm. वो चेंज हो गया. मीना अकाए. J is now in the leg. इंद्रधनुष बच्चा. Yes, that sounds like very nice, Prashant. I like your idea. बब्बू मोसाए. पप्पू पास करवाएगा. छोटू. मोगली. छोटू. मोगली. मोगली is still a decent name. मोगली. 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 Mission Indradhanush. Anyways, that's okay, beta. Let's come back to the child. Let's come back to the MCQs. Which of the following statement is not correct? Which is not correct, beta? Which is not correct? What do you think? Which is not correct? Energy for sedentary worker. Energy for sedentary worker is 1660. RDA for proteins is 0.83, age for reference is 19, RDA for dietary fiber is 130 milligrams a day. Which one do you think is wrong? Mini Modi ji. Which is wrong? Option A, option B, option D. Many are saying option D. Okay. Many are saying option D. RD for protein is 1 gram per kg per day. Manish Verma. Okay, very nice, beta. Very nice. You should remember the energy intake for workers. Energy intake for workers, you should remember the energy intake for workers. The person could be a sedentary worker. The person could be a sedentary worker, a moderate worker, a heavy worker. The person could be a male, could be a female. So remember, for sedentary worker male it is 2100 and for female it is 1660. Then to achieve the moderate worker amount number, you can add to this 500 and then you can add 600 to this. So if you add 500, how much will be the answer? 2100. If you add 600 to it, how much is the answer? 2700. On the same principle, if you want for the male, if you want about the male, you add 600 to this. So how much will it become? 2700, and then you add 700 to this, 3400. So very simple. Just remember that I have remembered sedentary worker male female 2100 and 1660. 2100 and 1660. Then you should also know that how much energy is required per kg per day. Per kg per day. So per kg per day, you can remember it as 90, 80, 70, 60, 50. 90, 80, 70, 60, 50. Right? So just remember 90 is given for all the infants. 80 is given for children. 70 is for adolescent. 60 is for male. 50 is for female. So this is the amount of kilocalories to be taken per kg per day. Per kg per day. So this is the recommended energy allowance. So just remember, this is pretty important. It can come to you in your exam. Next in line, which of the following is not correct? So option A is correct. RDA for protein is 0.83. Please remember, RDA for proteins, it is correct, 0.83. I don't know why many students are saying 1 gram, which is old answer. That is incorrect answer. Protein beta, we need 0.83 grams per kg per day. In case you are a male or a female, male will require 54 grams, female will require 45 grams per day. So B option is also correct. Option C, reference female is 19 to 39 years. Please note the reference male or a female. The reference male or female, their age group is 19 to 39 years. The male will be weighing 65 kgs and female is weighing 55 kgs. So this is also, option C is also correct. So which one is the only wrong answer? Common sense, the only wrong answer that you see on the screen is RDA for fiber is 130 milligram per day is wrong. It is RDA for fiber, please note, it is 20 grams per 1000 kilocalories. RDA for fiber, it is 20 grams per 1000 kilocalories. Okay, 20 grams per 1000 kilocalories. So option D is the wrong answer. A 30-year-old male member of the family is presenting. 30-year-old male member is presenting with complaints of diarrhea, knee edema, ascites. On investigation, they come to know mustard oil is the main item in grocery. What is the diagnosis? What do you think is the answer? What do you think is the answer? What do you think is the answer? Sanguinarine, absolutely correct. It is epidemic dropsy. Sanguinarine. Sanguinarine. This is epidemic dropsy. A very quick review about all the toxins. Please note neurolatherism. The toxin name is BOA. How do you prevent neurolatherism? The prevention is by vitamin C, or we can also use the steeping method. Next is aflatoxicosis. What is the fungus? Aspergillus flavus. It is associated with liver cirrhosis and food grains. What is the prevention? The prevention is by decreasing humidity. Decreasing humidity. Ergotism is a field fungus. It is Claviceps purpura, and Claviceps purpura, it affects mostly food grains, bajra, rye, sorghum. Yeah. So please note, we are going to talk about GI complaints, cramps. So ergotism is there in fields. Ergotism is there in the fields. So if you look at the ergotism, the bajra is usually very greenish and light color grains will be there. So this is the plant on the bajra plant. So now on this, there will be small spicules, which are the ergotism spicules. Remember, if I just show you the things, bajra, this is what you see on bajra. So you see on bajra these black color spiculated, so it is directly on the plants. This is what is claviceps. So claviceps beta, it grows on the plants itself. Claviceps, it grows on the plant itself. So the plant will be claviceps infested, right? खेत से फोटो होगी, बिल्कुल सही बात है, खेत की फोटो होगी. इट इज अ बाजरा. इट इज अ बाजरा. Okay, so coming to the next one, what is epidemic dropsy? Coming to the next one, what is epidemic dropsy? Epidemic dropsy is with a toxin called as sanguinarine. There is, please note, bilateral swelling of legs, diarrhea, dyspnea, pleural effusions, cardiac failure, congestive cardiac failure, glaucoma. The food product is oily, that is liquid. The toxin name is also liquid, sanguinarine, sanguinarine, and the classical clinical features are also liquid. How do you test for epidemic dropsy? We can test the mustard oil for argemone intoxication or sanguinarine presence by the nitric acid chromatography test. Nitric acid chromatography test is going to tell you about nitric acid chromatography test will tell us about sanguinarine. Endemic ascites is with the toxin called as pyrrolizidine. So just very quick points for you to remember for this thing, epidemic dropsy. The food product is argemone mexicana, adulteration in mustard oil, toxin sanguinarine, all these things. Management is with de-weeding in the fields or nitric acid chromatography test. So the best answer is absolutely correct, epidemic dropsy. Mostly it affects which one? Mustard oil. Mustard oil. Coming to the next one, next MCQ for applied nutrition program, seeds, manure supply under school health services. This is done by which organization? UNICEF, WHO, CARE, UNDP. Well, if we talk about United Nations International Fund, UNICEF, anything which happens in the mother and child health, anything which is for the nutrition, which also includes the midday meal program or the midday meal scheme, which also includes the ANP, that is the applied nutrition program. Applied nutrition program. Everything in this is due to, it is funded by United Nations. So CARE is for older people, UNDP is for HDI and GHI. They will calculate the HDI, GHI, WHO, you already know, they work for the health. So this applied nutrition program is 1963, applied nutrition program 1963, and that is what was funded by the United Nations. Coming to the next MCQ, which of the following is incorrect for Poshan Shakti Nirman scheme? What is this Poshan Shakti Nirman scheme? Poshan Shakti Nirman scheme, please note, it is a new program. Poshan Shakti Nirman scheme is a new program which is a new name for the midday meal program or the midday meal scheme. So now the midday meal program, midday meal scheme has been renamed to the Poshan Shakti Nirman scheme. So which of the following is incorrect? It is under Ministry of Women Child Development. It is to provide midday meals, includes Bal Vatika or the preschool, midday meals till 8th class only. What do you think is incorrect? Which of the following is incorrect? Absolutely correct, beta. Many of you answering the correct answer. It is not under Ministry of Women and Child. It is under Ministry of Education. It is under Ministry of Education. Very good. A few points about the Poshan schemes. We have a Poshan Shakti Nirman scheme and we have a Poshan Prime Minister overarching scheme for holistic nourishment. This scheme is under Ministry of Women and Child Development, beta. Poshan Abhiyan is under Ministry of Women and Child Development. Poshan Shakti Nirman scheme is Education Ministry. Now, this is a rename for the midday meal scheme. That is what is important. It is for primary classes plus the Bal Vatika students, and we are giving 450 to 700 kilocals under the midday meal scheme, or the new name is Poshan Shakti Nirman scheme. So what is the best answer to mark over here? Option number A is the best answer. Which of the following is incorrect? Next MCQ. Which of the following is incorrect? Which is incorrect, beta? Jai Vigyan mission is for rheumatic fever. What do you want to say? We already did this. This is correct. Health and wellness centers are renamed as Ayushman Arogya Mandir. Ayushman Bharat scheme is for 10 crore population. Mission Shakti is for women empowerment, which is incorrect. Mark the incorrect one. What do you want to say? A option is correct. That's the only one I can help you in answering. Very nice. You caught my tricky MCQ. I thought I'll play around with you guys. So yeah, you did not let me play around. I love you for this. So it's not 10 crore, it is 50 crore population, and it is 50 crore population. Very nice. Very nice. And it is not population 10 crore families. It is for 10 crore families. It is for 10 crore families or for 50 crore population. This is the only one which is incorrect. Please note, a recent update for you is that the health and wellness centers have been again renamed. Earlier we had the sub-center, they renamed to Health and Wellness Center sub-center. And now the Health and Wellness Center sub-center is renamed to Ayushman Arogya Mandir. AAM. Ayushman Arogya Mandir. So Mission Shakti is for women empowerment. You should know this. Mission Shakti, it is for women empowerment. Beta, Mission Shakti has two parts to it. There is a Sambal scheme, that is, you can remember it with Sambhal, Sambal, and then there is a Samarthya, that is with Samarth. Samarth is to make them empowered, and Sambal is to give them safety. Sambhal, safety. Samarth, empowered. Sambhal safety is with Nari Adalat to just give them more secure environment to live. Samarthya is to give them empowerment, give them money, cash incentives for mother care. Ujjwala scheme, that is to give them LPG fuels. National Crèche scheme, Swadhar Greh, and all these things. So just remember that these are Sambal and Samarthya. Why this frequent change? Beta, you are living in a democratic country. You have the full right of freedom of speech. Aap boliye, and you can even write it to the Prime Minister office that why do you keep on changing so many things? Even we are tired. Even Mukhmohit is tired. Everybody is tired about these changes. So you are very welcome, and it will be a very welcome change. Please write it to the Prime Minister office. I did not change. So this is, you need to remember for the Mission Shakti, that there are two parts to the Mission Shakti, Sambal and the Samarthya scheme. Then that's it. Mission Shakti is there, Ayushman Bharat is there, and that's it. You have done this. Let us go to the next MCQ. Will hain bilkul Gagandeep kaur ne tika ke bola. That's what it is. Yes, will hain log. अब कुछ तो काम करना है ना सरकार को भी. कुछ तो काम करेंगे. क्या करेंगे? जो ऑलरेडी स्कीम है उसका नाम चेंज करेंगे तो पब्लिक खुश होएगी. पीपल विल वोट बैंक, एंड बेचारा डॉक्टर नया MCQ लिखेगा, बनाएगा. दैट्स हाउ वर्ल्ड वर्क्स. विच ऑफ द फॉलोइंग इज नॉट ए क्वांटिटेटिव मेथड फॉर हेल्थ मैनेजमेंट? व्हाट डू यू वांट टू से? Which of the following is not a quantitative method for management? What do you want to say? A. Many are answering A. Okay. Many are answering A, B, C, D. Okay. Program evaluation, review technique, management by objectives, work sampling, decision methods. So, which of the following is not a quantitative method? This has been asked 2-3 times. So, there is this flashcard. This flashcard is available to you. It is on my Instagram profile, and all the flashcards are already available on my Instagram profile. These all flashcards are numbered, so there is a sequence, and all the flashcards are almost always put up in the Telegram channel as well. So we have a channel on the Instagram or the Telegram, so you can access these flashcards from many of the places. Please note that the management designs can be of two types. We can have the qualitative designs and we can have the quantitative designs. The qualitative designs are like organizational design, personal management, communication, information. The only MCQ you need to remember is qualitative design is also by management by objectives, which many people will think it is by quantitative design. Management by objectives, maybe people will think it is by a quantitative design, but please note it is a qualitative design, management by objectives. On the other hand, the qualitative designs, these are cost benefit analysis, cost effective, network analysis like PERT and CPM, program evaluation techniques and critical path methods, and work sampling, programming and decision making. Work sampling will tell you about what work sampling, about the type of work which is done, how much time is required, who will require the work, and how many people are required to do the job. This whole things are assessed by work sampling methods. So all these are quantitative designs. So which of the following is not a quantitative method? Management by objectives is not a quantitative method. False about ESI in India is, which of the following is false about ESI in India? Which of the following is false or not true about ESI in India? What do you think is not true? Just answer this. I'll be back in a moment. Just answer this. I'll be back in a moment. This video will be running on live, so I'll just be back in a moment. Yeah, so I'm back again. It is 15,000, 15,000, 15,000 is given. Absolutely correct, beta. Absolutely correct. It is 15,000. Option C is the correct answer. Option C is the correct answer. So center contributes 7/8 and state is 1/8. Every state is 1/8. This is correct answer. The worker with income less than 176 per day is exempted. Please note, a worker whose monthly salary is less than 21,000, only they are eligible. In case of physical handicap, it is increased up till 25,000. This is for physical handicap people. Physical handicap. And for physical handicap, do you know that the employer share for 3 years is given by the government? The ESI will contribute the employer share for 3 years in case of physical handicap. It is just to promote physical handicap people in employment in the organizations. So A and B both are correct. Funeral expense is not 25, it is 15,000. Funeral expense is not 25,000, it is 15,000. That is the correct answer. That is the answer you're going to mark. And medical care is also provided to the retired at a rate of 120 rupees. This is also correct. At a rate of 120 rupees, it is also given. So D is also correct. So what is the best answer you're going to mark for your exam? It is option number C, which is the only one which is correct answer. Under ICDS, calorie requirement is how much? So under ICDS, calorie requirement is how much for a pregnant female? For a pregnant female, how much is the calorie requirement? What do you want to answer? How much is the calorie requirement? C. Yes, absolutely correct. You should be knowing that for a pregnant female, absolutely correct, beta. For a pregnant female, in case of ICDS program, all children will get 500 calorie, 12 to 15 gram. Severe malnourished child is 800 calorie, 20 to 25 grams of protein, and P and L female will get 600 calorie and 18 to 20 grams of protein. For this, the amount of cost which has been approved by Government of India, it is 6 to 8 rupees depending on the area, then 9.5 rupees and 12.5 rupees for the ICDS program. So the best answer is absolutely correct, 15 to 20 grams of protein and 600 kilocalories. Next is, which of the following is not correct for biomedical waste? What do you want to answer? Plastic vacuolas with blood are disposed in yellow category. Gloves after dressing are disposed in red category. Unopened vials with live vaccines are in blue category. Syringe with fixed needle go to the white category. Which of the following you think is the incorrect? Which of the following you think is the incorrect answer? So, which one do you think is incorrect? Many are saying option C, which is absolutely correct answer. You have answered correctly. Very nice. You all are good at biomedical waste. Please note, it is not option B. Gloves, I request you to remember, gloves, whatever it is, blood, without blood, with feces, with urine, with pus, with whatever it is in the world, gloves go to red category. Gloves are red category. Yellow category is divided into these 8 categories. You have yellow A, yellow B, C, D, E, F, G, H. F stands for the fluid category, which is the liquid chemical waste, or it also contains the body fluids. It also contains the X-ray developer fluid. G stands for the gown, linen, beddings, mattress. H is for microbiological waste, laboratory waste, biotechnology waste, and H is also for the hazardous, that is blood and blood products. E stands for chemical waste. D is for discarded medicines along with cytotoxic waste plus their consumables, that is the IV line of the cytotoxic waste and everything. Soiled waste is for all the dressing waste. Cotton, gauze piece, plaster, cast, cotton, everything is soiled waste. Sir, expired cytotoxic drugs in glass ampoules will come in yellow or blue? Yellow. Cytotoxic is all yellow. Animal waste and anatomical waste. So these are the yellow categories. In the red category, you will discard Ryle's tube, vacutainers. Please note, vacutainer with blood is yellow category, vacutainer is red category. Syringe without needles. Please note, syringe without needle is red category, but syringe with fixed needle is white category. Any type of glove is red category. IV bottles, IV set, urine bag, Euro bags, urinary catheters, Foley's catheters, Ryle's tube, nasogastric tube, all these are red category. Please note, broken glass, broken ampule, empty vial. Okay, all these are broken glass, broken ampule, broken vial, empty vial. All these are B category, broken category. And then you also have to remember bone implants or ortho implants, not the bone implants technically, like orthopedic implants. These orthopedic implants, they are also part of the blue category. They are also a part of the blue category. On the same principle, if you talk about the white category is anything which is sharps and needles. Please note, very frequently asked MCQ, where to discard the intrauterine device. It goes to the red category. Next MCQ, very frequently asked, where to discard pacemakers. Pacemaker is a battery containing device. It is not a biomedical waste. It has to be returned back to the manufacturer. It's not a biomedical waste because it's a battery containing device. Next is, many times students ask us about gloves. Any type of gloves, please note, any type of gloves have to be going into the red category. Then they ask us about BT set, about the IV transfusion set, about the platelets. Where will you discard them? They all go to the yellow category. They all will go to the yellow category. So vacutainers, please note, vacutainer is a red category. Vacutainer with blood is a yellow category. Vacutainer with blood is a yellow category. So amount of light reaching surface is measured in, what do you want to say? Lambert flux, lux, luminous intensity. Amount of light reaching surface is measured in Lambert flux, lux, luminous intensity. So light reaching surface is measured in lux, always lux. Remember, what is Lambert for? Lambert's is for re-emitted light. Flux is for lumens, that is the flow of light. Lux is for the illumination or luminescence, that is for what do you call that? Light reaching surface, light reaching the surface. And luminous intensity, that is the luminous intensity, it is about the brightness of the source, that is candela, source brightness. Illumination is lux lulu. That's a nice way to remember, lulu. Lux bright light candle चक्का है, so से याद रखो, lux bright light candle चकता है. Nice. मुकुल सिंह, आपका भी तरीका सही है, लाजवाब है तरीका आपका. Which of the following is not correct for Human Development Index? It has 3 dimensions, 4 indicators. So which one do you think is the correct answer, beta? Light reaching surface. What is the best answer? It is option C. That is lux. Coming to the next MCQ, which of the following is not correct for Human Development Index? It has 3 dimensions, 4 indicators. ए भाई फिर से आ गया ये. Which of the following is not correct for Human Development Index? It has 3 dimensions and I don't know, there's something bad in this PPT today. Yeah, sorry for the interruption. Yeah. Which of the following is not correct for Human Development Index? What do you think? It has 3 dimensions, 4 indicators. represents the standard of living. It is a geometric mean of the dimension index, accounts for GDP per capita. So most of the students are answering option C. It is geometric mean for dimension index. What do you want to say? Which of the following is not correct? Which of the following is not correct for HDI? Which of the following is not correct? बड़े बड़े शहरों में छोटी चीज़ें चकती हैं, आईपैड रूल का कुछ झुकना नहीं है, झुकेगा नहीं, है ना, हमें बढ़ते रहना है. यस, हमें झुकना नहीं है. So it has 3 dimensions, 4 indicators. Yes, this is true. Represents the standard of living. Yes, this is true. It is a geometric mean of dimension index. Yes, this is true, beta. It accounts for GDP per capita. It accounts for GNI per capita. It does not account for GNP. It accounts for GNI, gross national income. Gross national income. Beta, a few points about HDI. A few points about HDI, Human Development Index. ये किसने बनाया था? Human Development Index was made by the UNDP, United Nations Development Program. Under HDI, there are 3 dimensions. What are the 3 dimensions? That is the life expectancy. Next, they will talk about the knowledge dimension. And last is they will talk about the standard of living. Standard of living dimension. The life expectancy is calculated at life expectancy at birth. The knowledge has 2 things, that is the mean school years, and then it also has the expected school years, and then the standard of living, it is measured in terms of the GNI per capita. Standard of living is measured in terms of GNI per capita. Now the live birth, everything is going to be, this whole things are the indicators. So now how do we calculate the HDI? To calculate the HDI, we take all the dimensions beta and their indicators. We calculate something called as the dimension index. How do you calculate the dimension index? The dimension index is given by a formula, the actual value of that parameter in that country. India will have its own value for the life expectancy. India will have its own mean school years, expected school years, and the GNI. So now you take the actual value minus the minimum value, which is already given by the WHO, United Nations, divided by the maximum value minus the minimum value. So technically the denominator is same by the United Nations. What is going to change the numerator? In the numerator, the actual value is going to change the whole game. So that is how you calculate every dimension ka index. You will calculate the dimension index for life expectancy. You will calculate the dimension index for the knowledge. You will also calculate the dimension index for the standard of living. So now what you will do is you will take all the dimension indices and then you are going to obtain the HDI. How do you take that? You will calculate the geometric mean of all these. You will calculate the geometric mean of all these. And that is where the MCQ had come. Okay. So please note, absolutely correct. Pranav gave us very good knowledge that yes, beta, HDI for India is 0.63. India is in the rank of 132 countries in the whole world, and India is in a level of medium HDI, right? So you can just see that India is in a value of 0.633, 132 rank among 191 countries, and the probable decline was in terms of like the life expectancy. That is the main determinant in this whole HDI. And it talks about Human Development Index, talks about life expectancy. Very frequently they ask you these questions. You can take a screenshot of this. And this you should be taking the screenshot with the understanding that this is very, very frequently asked topic, and with the point that you have to see like with small nuances. Overall development is given by HDI, but do you know economic development is HDI, but do you know overall development, if the country says overall general indicator, it is IMR. So you have to understand the words over here. Overall country development, it is IMR. Country development, political development, it is United Nations indicator, that is under 5 mortality rate. Life expectancy is also given by HDI. The hunger malnutrition is given by MPI. What is MPI? Multi-dimensional poverty index. Now multi-dimensional poverty index or the GHI, they both will give us the hunger and malnutrition in the area. GDP, GNP, GNI, das do beta. It's not required, Gagandeep. Beta, you don't want to bang your head on these economic terms. GDP, GNP, and the GNI. Just for your knowledge, because you have asked, GDP is the gross domestic product. In-house, how many people are earning per capita, you will take out. GNI is the gross national income. It includes the foreign income and the domestic income both. So GNI is a better indicator compared to the GDP. GDP talks about the domestic thing. GNI talks about domestic plus the NRI income, all the outside income. Okay. So then overall maternal care, it is managed, it is best indicator is MMR. Overall healthcare services is perinatal mortality rate. Burden of disease, please note, it is DALI. Effectiveness of intervention is QALY. Healthy life years is HALE. HALE stands for health adjusted life years. HALE is for health adjusted life years. HALE is for health adjusted life years. So just a few questions more. Internalization and adoption occurs in which model of health education? Internalization and adoption occurs in which model of health education? Medical model, social environmental model, service model, or motivation model? Very simple to understand, nothing very hi-fi. Let's start with the easy one first, that what is a service model? Service model says that the services should be provided at the doorsteps. So services should be provided at the doorstep, at the door. So we will give you services at your door. We will, the teacher will come to your mobile. So we will enter your mobile and we will show our faces and say Tappa. That is service approach. Everybody gets free of cost. Everybody wants free session on YouTube. That is a service approach. Next is, we also have health education approach, where people are informed, encouraged to make their own choices for good health. So where students are informed that for your own betterment, you make your own choices, that how do you want offline, online, YouTube, mobile A, mobile B, platform A, platform C, whatever it is. That is health education approach, where people are informed and educated and they take educated decisions. Primary healthcare approach is with community participation. Underline and highlight this word, community participation. So the main key feature in Indian healthcare system, we don't provide, it has been seen that the service approach is like the worst thing. People will not use your services, they will not cater to the healthcare requirement which is being given free of cost. Health education approach, it is followed in most of the developed countries, where they educate the people, people take their own decisions based on their own attitudes and behaviors, and that's how the community grows. But it requires more intellectual and it requires social upliftment of people. In India, what we are following is a primary healthcare approach, where there is community participation, people are going to participate and seek their own system. Now we also have something called as motivation model. Motivation model is motivating the people to take part in their health decisions. So there is health information and then there is desired action. So what I want to say is that you create awareness in people so that they become interested. Then these people in second phase, they will try that, acha, this is how it happens, let us give it a try. And third is adoption and dissemination. They adopt the new lifestyle. This is called as a motivation. This is the most evolved. It is the most evolved in the sense evolved method of health education, which requires the highest level of social upliftment. It requires highest intellectual level, where the people are so much, you can say, evolved, that they can be made aware, they will evaluate, and they will adopt a certain behavior. So motivation model is adoption model. Other models are like medical model and social intervention model, where different social groups are formed, like NGOs are there. They will they will work for health upliftment in the area. In many developed countries, there are mental health care groups, there are counseling, psychological groups. In India also, we have HIV groups, we have TB groups, we have alcohol awareness groups, drug abuse groups, and so on. Medical model is which are used for treatment of disease and for technological advancements. So that is about the medical model. So for this, internalization and adoption works on which model? It works on motivation model. Answer is option D, that is motivation model. Service is not a good answer. Social environment would be if NGOs and social groups are there. Medical model is based on more medical advances and very hi-fi type of treatment is given, so that is also not the answer. Adoption, internalization is motivation model. Which of the following rights are protected under the COPRA Act? Right to safety, right to choose, right to seek redressal, right to participate in the clinical trials. Which of the following rights are protected under the COPRA Act? Which of the following rights are not protected? You have to mark one answer which is wrong. Which of the following right is not protected under the COPRA Act? What do you want to answer? Which of the following right is not protected under the COPRA Act? Consumer Protection, Consumer Act. Yeah, so most of you are answering correctly. I'm so proud of you guys. Right to participate in clinical trials. Right to participate in clinical trials. So COPRA, Consumer Protection Act 1986. There are 6 rights. 6 rights. Right to safety. People should have right to be informed about the product. Right to choose which one to take. Right to be heard, right to seek redressal in case of any problem, and right for consumer education. Please note, the right to participate in clinical trials is not a right of a person, and it is actually based on the inclusion exclusion criteria of the clinical trial. So you should be memorizing this and about the COPRA Act, and that's all for the session today. If you have any doubts, but I think it's already been around 1.5 to 2 hours, and you all have given me a lot of your time. If you have any doubts, you are very welcome to ask it. If you have any doubts, you are very welcome to ask it. Sir, yellow fever. Please conduct more sessions. I would love to conduct more sessions. यार वो time का है. There's so much constraint ना. Yeah, I will be conducting more sessions on this. I take your advice. Yeah, Shalu, thank you so much. Talking about the yellow fevers. One student asked about the yellow fever. Yellow fever vaccine beta, it is a 17 delta vaccine, 17D vaccine. It comes under a live vaccine. This live vaccine, the effect starts in around 10 days, and effect will last for lifetime. It is for lifetime. Although it is a yellow fever is a live vaccine, please note pregnancy is not a contraindication for the yellow fever vaccine. Why? Is it safe in pregnancy? Answer is no, because yellow fever is exotic in many countries. In many countries it is not there, and that is the reason the pregnant female, she cannot go to yellow fever area and come back and say, I did not take a yellow fever vaccine because I was pregnant. It doesn't happen like that, because you are putting a whole population at risk. So please note, pregnancy is yellow fever vaccine safe? Answer is no. It is yellow fever vaccine is not safe in pregnancy. But is pregnancy a contraindication? No, pregnancy is not a contraindication. You should also know that yellow fever only contraindication is egg allergy. Because we do not have eggless yellow fever vaccine. So it is, we do not have eggless yellow fever vaccine. Egg contained by yellow fever and Q fever, please let us know. Yes, egg is there in yellow fever. So Arjit, thank you, Somita, thank you for joining in our session. Vidushi, yes, I will take up this point. I will try to do more sessions on this. When to give Navirapine and Zidovudine prophylaxis in mother to child transmission. Beta, in mother to child transmission, you have to see whether the child is a low risk of transmission or the child is a high risk of transmission. In case of high risk of transmission, the drugs that we are going to give is Zidovudine plus Navirapine. In case of low risk, it is only Navirapine prophylaxis. This both have to be given for 6 weeks. In what situations we will give it for high risk? High risk is if the mother had not been taking ART, or if she was taking ART which was less than 4 weeks. In case she was taking ART since less than 4 weeks. In case the mother has a viral load of more than 1000 copies per ml, or in case the mother is having any other, in case the child is having any features or any comorbidities, in those cases there is very high risk for a child to develop this, and therefore we give the high risk prophylaxis. Sir, please conduct more sessions. Yes, Meena Akai, I will try to conduct more sessions. Thank you. Miss DMPA के बारे में बता दो sir. Missed DMPA, in case the female misses DMPA, she can take up till 4 weeks. 2 weeks पहले and up till 4 weeks she can take. And I think with that we close off all the doubts. And thank you so much for joining in today. And I wish all the very best, beta, for your NEET exams. Of course, we will meet 1 or 2 times more before the NEET exams. And I wish that you all keep on studying very, very hard. It's just very, very around the corner. It's just 2-3 weeks we are left. Sir, if a mother brings her 6-month child, what vaccines can be given? If a mother brings her 6-month child, what vaccine can be given? So 6 months old child, you are going to give all the vaccines which are pending to the child. That is BCG, we will give the pentavalent, we'll give the we'll give the BCG, the pentavalent, the OPV, the FIPV, rotavirus vaccine, PCV vaccine, PCV1, Rota1, FIP1, OPV1, pentavalent 1, BCG, everything has to be given to the child. Okay. Shalu, that was for you. How to remember the NTEP regime? Beta, NTEP regime is pretty simple to remember. The NTEP regime. कौन पूछा ये? प्रशांत कुमार. Beta Prashant, the NTEP regime is pretty easy to remember. In this, you have a drug-sensitive TB regime or a drug-resistant TB regime. The drug-sensitive TB regime is 6 months. It is total is 6 months, like 2 months of H, R, Z and E and 4 months of H, R and E. What do you mean by 2 and 4? 2 and 4 means the months. 2 and 4 means the months. So now MCQ may ask you how many doses are there. In 2 months there are 8 weeks. 8 weeks is 7 days. So 7 days into 8 is total is 56 doses. Do not get confused that maybe it is 2 months, so it will be 60 doses. Galat. 4 weeks will contain 112 doses. Okay. So that is for the drug resistant and drug sensitive TB regime. Drug resistant, you can have H mono DRTB. That is only isoniazid regime. That is only isoniazid resistance. It is giving 6 months of zero regime. 6 months of zero regime. What do you mean by zero? Zero stands for Z is pyrazinamide, E is ethambutol, R is rifampicin, O stands for levofloxacin. Levofloxacin. And that's the only one which you actually require. Then for MDR cases, we are giving 4 to 6 months of Chobzi plus 5 months of Cozy. What is Chobzi? C stands for clofazamine, H stands for high dose isoniazid, O stands for same answer levoflox, B stands for bedaquiline, Z stands for pyrazinamide, E stands for ethambutol and last E stands for ethionamide. So you can remember easy, 4 to 6 months of chobzi with 5 months of cozy. Thank you so much. You did this for every time comes and helps us. एक शायरी हो जाए सर मोटिवेशन. यार FMG वाला भाई मेरे FMG is already done. We did it so many times. FMG has been done very very recently. FMG हमने किया ना. Right? PSM Punch है YouTube और yeah it's available on YouTube. So thank you so much for joining in the day today. वो कहते हैं ना कि इत्र से कपड़ा महके तो क्या बड़ी बात है. ओके, इत्र लाइक द परफ्यूम, इत्र से कपड़ा महके तो क्या बड़ी बात है. मज़ा तो तब है बेटा कि खुशबू आपके किरदार से आए. So make sure that you are struggling very hard and you're working so that you improve on your ranks and you improve on the way and the level of preparation that you do, right? So yeah, chalo, all the very best beta, all the very best, and thank you so much for joining in, and I'll see you sometime soon. I cannot guarantee I'll see you sometime very very soon. I wish के और हो, बट एनीवेज कीप योर प्रिपरेशन गोइंग ऑन एंड अपने आप पे इतना भरोसा रखना एंड यू हैव टू ट्रस्ट योर सेल्फ कि हमने इतनी ज़ोर से पढ़ाई करनी है बेटा कि नोबडी इज़ एबल टू वर्क बेटर दैन अस. In these last 20 days, I will promise to myself that I have to put in my best effort. You have to do that. And once you believe that, beta, people who have cleared the exam, वो भी तो आप जैसे ही लोग हैं. So you have to put in your best foot forward, and everything you do is going to give you the fruits. Whatever you do, you enjoy, it will give you the result. जो बीज बोएगा वही पेड़ उगेगा. You put in hard work, you will reap the benefits. You don't put in hard work, you will not be able to reap the benefit. Sir, one session before 23rd June. Let's try to do it. And thank you so much for joining in the day today. All the very best, beta. All the best. Take care and bye-bye.